I'm Maria Teresa Kumar. Donald Trump has gone from COVID skeptic to COVID patient. The president is spending the weekend at the Walter Reed Medical Facility in what the White House is calling a precautionary measure after he was diagnosed with COVID-19 early Friday. Overnight, Trump's doctor said Trump is resting comfortably, had received a dose of remdesivir, but has not received supplemental oxygen. And Trump himself tweeted last night that his treatment is, quote, going well. Meanwhile, the number of Republican lawmakers and people connected to Trump who have been diagnosed continues to grow. Just in the last hour, we learned that Senator Ron Johnson of Wisconsin has tested positive. He joins two of his senator colleagues, Tom Tillis and Mike Lee. Both Tillis and Lee were at the Rose Garden ceremony for Amy Coney Barrett last week. At least 7 people who attended that event have now tested positive. Joining me now, MSNBC science contributor Laurie Garrett, author of The Plague is Coming, former senior advisor to the White House Coronavirus Task Force, Olivia Troy, and MSNBC political contributor, Yamiche Alcindor. Thank you for joining me, ladies. Laurie, I would like to start with you. You had a piece today on foreign policy headlines saying that, and it's element 1, foreign policy headlines saying only state-of-the-art medicine and luck can save Trump now. Can you talk a little bit about what you meant?
Well, of course, I don't write the headlines, so I did not write that headline. But my article says that we know now that Trump has a lot more underlying medical conditions than he's ever really allowed the world to know about. He has tried his level best to appear very youthful, to have no trouble walking, no trouble lifting glasses of water to drink, no difficulty slurring words, all these things. He's gone out of his way to have medical assessments appear that, number one, he's in the fittest state of health, and number two, that he's considerably younger than Joe Biden, who he likes to portray as sort of old, doddering, and senile. But of course, they're only 3 years apart. What we do know, and as we dig deeper, we're finding more, is that indeed the president has had quite a number of underlying conditions and may, in fact, have some cardiovascular issues. So this puts him, coupled with his obesity and his age, in a very high-risk group once infected with the COVID virus. This means that he is likely to be under treatment for a considerable amount of time, and he certainly can't go out campaigning. He certainly isn't going to be in a position to mix with others in any considerable way that would contribute both to his campaigning and, frankly, to running the government. So my advice is that Mike Pence should remain close to Washington, able to step in and run the Oval Office should the president's condition worsen.
Olivia, you were part of the coronavirus task force. I want you to take a listen to this, please.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it.
A lot of people don't want to wear masks. There are a lot of people think the masks are not good.
Dr. Fauci said the opposite.
He did not say the opposite.
We got a little bit more than a minute left in this
masks
segment.
Masks are not good. Then he changed his mind. He said masks are good. I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
Olivia, you were inside the White House. You were part of these conversations with the task force. Are you surprised the president contracted COVID?
Unfortunately, Maria, I'm not. I saw how cavalier everyone was inside the White House, and it's been a hard 24 hours to watch what has been happening, and I know some of these people very well. I work side by side with them. But on the other hand, I can't help but think this is plain karma. I mean, everything that the president has been saying to the public has put the public at harm. And now you're watching it play out inside the White House. All of these guidelines and everything, the advice that the doctors and the scientists have been trying to get out to the public about why mass gatherings are not good, why it's so critically important to wear a mask. Get these people inside the White House. I was one of them. We were there. I watched it firsthand. They did not follow these guidelines. And now the American public is watching it play out in the most powerful office.
Yamiche, you also tweeted that many of reporters that were part of the White House press pool have contracted the virus. As someone that frequents the White House, what have you seen, and are you surprised?
So what I've seen is reporters definitely have made sure to wear their masks consistently. But at the White House, even yesterday, we saw senior White House officials not wearing masks as they were taking questions from reporters. And this is after the president had been diagnosed with COVID-19. So before this, we saw a White House that was holding large events, thinking back to the Republican National Convention, where they had hundreds of people on the South Lawn of the White House, not socially distanced, not wearing masks. I was there on Saturday at that event where they were rolling out Amy Coney Barrett as their nominee to the Supreme Court. President Trump was not wearing a mask, and there were many, many people. We've all seen the pictures in some ways. Many, many people that were not wearing masks. Kellyanne Conway, Mike Lee, a number of other people, the president of Notre Dame. Something like 7 people have now tested positive just from that event. So what you see here is really a White House that was trying to put the virus in the rearview mirror. Just a few days ago, the president said the end of the pandemic is near. And now what we see is something that is unfolding in the United States that you do not see in other developed, modernized nations. And that's higher death rates. But that's also a federal government that is now upended because it could not protect itself from the virus. So the president has been saying over and over again that he wants to keep people safe. But now he had to be medevaced away from the White House last night, and he is now hospitalized and taking a number of treatments, at least 2 that we know of, along with supplements, and he's saying everything's going well. There are some White House officials who are telling reporters this is business as usual. There is nothing business as usual about the federal government of the United States and the leader of the United States being in a hospital and having to work there